Good afternoon. Cabinet met today to discuss the latest status of the Omicron outbreak in New Zealand and to update our COVID-19 response. This was preceded by a ministerial call with the chief executives and senior officials from every government department involved in the COVID response. A quick status update on some key facts, figures and decisions. To date, we have identified 29 community cases associated with the January Omicron cluster. All are in isolation. Investigations into the source of the cluster are continuing, but we are yet to establish firm links to a known border case. And whole genome sequencing for Omicron may make it difficult for us, in fact, to ever establish the source of the outbreak. Nearly 60% of eligible New Zealanders have now had their booster, and 1 in 5 children under 12 have had their first dose from yesterday's data. Bookings in the system are high at 262,000, for which 186,000 are boosters at over 1,000 sites, with extra vaccination clinics such as Auckland's Westgate and Mount Wellington vaccination sites shifting to drive-through this week to increase capacity. You can, of course, as always, book now for your booster at bookmyvaccine.nz or find a walk-in or drive-through at healthpoint.co.nz. Now, we know from overseas experience that time is of the essence with Omicron. Boosters and basic infection control can slow it down in this stage. So if you're due your booster, if it's been 4 months or more since you got your second shot, please get in there as soon as possible. It will keep you safe from serious illness and it will preserve our hospitals. It's pleasing though to see that over 73% of eligible people over 65 have now been boosted. And every DHB is on track to complete their booster programs in aged residential care facilities within the next week. This is important because, as we saw with Delta around the world, high rates of vaccination among older population and those at greatest risk of serious illness play a major role in preventing widespread outbreaks. And so my message to over 65s is let's do that again. Let's reduce the threat of Omicron just as we did for Delta. Basic infection control also plays a really important part in minimising the threat: hand washing, distancing, masks. Which is why, as we previously signalled, today Cabinet has agreed to enhance the mask-wearing protocols in the red setting of the COVID-19 protection framework to further assist in the slowdown of Omicron. Today I can announce the following changes to mask-wearing at red. Masks must now be worn at food and drink businesses, close proximity businesses, events and gatherings. The existing exception of when you are eating and drinking and exercising still apply. We are, for instance, asking people at restaurants when they enter or when they get up to use the bathroom to use masks. These changes also won't apply to non-public facing workplaces, swimming pools, and gatherings where you have the exclusive use of a premises. We really do encourage all workplaces, though, to think about mask use policies that protect your workforce, and I know many businesses are already doing so. We're also now requiring that a face covering be an actual mask. That means no more scarves, bandannas, or as some of us may have seen from time to time, t-shirts pulled up over the face, for example. This is to ensure that it is a mask designed to cover your nose and mouth properly. All workers who are legally mandated to be vaccinated must now also wear a medical grade mask. For example, a type 2R or level 2 mask or above while working in public facing roles. So that includes, for instance, the widely available blue medical grade mask that many are already wearing. As you know, all primary and secondary school students year 4 and up are already required to wear a mask. For consistency, they will now also need to wear a mask on Ministry of Education funded school transport services and public transport. I know that some of these adjustments might cause challenges, but the science has been updated, and these adjustments will slow the spread of the virus, save lives, and give us time to get more of the eligible population boosted. These changes will not come into force until 9 days' time. That allows these changes to be gazetted, but it also allows workforces, in particular, time to prepare and ensure that they have access to what are widely available medical grade masks. The Ministry of Health will also be updating guidance on masks for the public. How to safely reuse masks, for instance, because it is possible to reuse many masks safely if done properly and ensure the best fit. My final word on masks. We've looked at a lot of overseas data on who is most successfully managing Omicron. Masks play a significant role when done right. Now, we've made a major shift in New Zealand by adopting their widespread use. Now we just need to tighten them up slightly so we get the best out of this really important measure. Tomorrow, Minister Verrill will set out our response to Omicron across the 3 likely phases we will experience. As I previously set out, in phase 1, the early stages, which we are in now, we'll continue with the same testing, tracing and isolation settings as we have used before. That's because this helps us to slow Omicron down. But as caseload grows, these settings will change. Looking to outbreaks around the world, we've seen that where this is most important is critical workforces such as healthcare, supermarkets, supply chains and other industries and services critical to delivering the necessities of life. Today I can confirm how we intend to use rapid antigen testing to help critical workforces, businesses and supply chains stay open. And this is to allow a test to return to work approach. This approach will mean that critical workers who are identified as close contacts will be able to use proof of a negative rapid antigen test to return to the workplace during their required period of isolation. This will minimise disruption to critical infrastructure and supply chains, helping to keep New Zealand going. But we're also focused on making sure that we apply it to those who are deemed critical, so we reduce the risk of people being exposed to a contact who still may have COVID-19. For now, though, PCR tests are best. We need their accuracy to hone in on the spread while Omicron is in its infancy and can be slowed. And in preparation, we've significantly increased our PCR or nasal swab testing capacity. We can do 60,000 tests a day, with surge capacity to just nearly 78,000 tests a day, which can be sustained at a surge rate for approximately 7 days. Once we reach phase 2 of the outbreak and Omicron is more widespread in the community, rapid antigen tests will be more common in our testing strategy. We have 83 million rapid antigen tests on order amid huge global demand. We continue to pull out all the stops to secure what we need here in New Zealand. In total, as I've already set out, New Zealand has 4.6 million in country. We have confirmed delivery of an additional 14.6 million over the next 5 weeks. On top of that, we are awaiting the delivery schedule for an additional 22 million over the same period. So that's more than 40 million tests for a 5-week period in total. We continue, as does just about every country at present, to seek additional supply. But as you will have heard, it is a very competitive space for rapid antigen tests currently. There are currently 9 types of rapid antigen tests approved by the Ministry of Health for use. A further 19 are under full technical assessment. Now, this is an important process, as the effectiveness of rapid antigen tests can range from 30% accuracy through to 80% accuracy. We'll also continue to do what we can, though, to of course support businesses who, whilst they are able to seek supply of rapid antigen tests directly from manufacturers, we know that it is difficult for many to secure that supply. So whilst we, for critical workforces, will support them by providing rapid antigen tests, we continue to encourage those businesses to also do what they can to help manage the health of their workforces and draw up contingency planning for their workforces. Further today, you would have seen the work done to secure CO2 monitors and 5,000 portable air cleaners for our schools to keep them open, keep our kids learning whilst reducing the threat of Omicron in our schools. Those CO2 monitors will help us assess the quality of ventilation in different classrooms, and schools will be able to adapt their ventilation plans to make sure they've got good through flow to reduce the spread of Omicron within the school environment. It's a summary of today's decisions. Ultimately, though, you'll hear the detailed Phase 2, Phase 3 plan from Dr Verrill and the Ministry of Health tomorrow afternoon. I'll ask Dr Bloomfield to join me on the stage as we now take your questions. Jenna, then Jessica.
Are you basically asking people to wear masks indoors other than when they're at home?
You will have seen that we do still have exceptions. So for workplaces where they're not customer facing, there we're asking workplaces to work through plans that really suit their working environment. So they're not mandated there, and we still have practical exceptions. Of course, we're not expecting someone in a restaurant to wear a mask while they're dining, but as much as possible in environments where you're not distancing, just good practice is to wear a mask. I'll let you finish, Jessica, and then I'll come into this one.
Why are we only getting rapid antigen tests when we're in the thick of an outbreak? When did you order them?
Oh, we've been ordering for some time, but perhaps those more closely involved with the ordering process could pick up that question.
Certainly. Thanks, Prime Minister, and kia ora koutou. Yes, we've been working for some time on ordering rapid antigen tests in what is a very, very competitive global market, and we have a lot on order. The challenge is, and what we are working with the suppliers on, is getting confirmation of delivery against those orders. Pleased to say we've got quite a lot, another 14.6 million confirmed delivery before the end of February, but then over another 20 million, we're just waiting for the timing of the delivery. So we've certainly been ordering, and we continue to order from that increasing range of suppliers of those newly approved tests.
Would you be using them more now if you had more in the country?
No,
we wouldn't. No, this is one of the things that's very important, and that I won't say is unique to New Zealand, but New Zealand is in a very small range of jurisdictions that, because we have such very low prevalence, rapid antigen testing just plays a very small role in the current settings. It's as we move to higher incidence of Omicron and of the virus in the community that rapid antigen testing starts to play a role, and that's why we've planned for it in phases 2 and 3.
Important to keep in mind, of course, that we've also in that first phase where we are using PCR testing, which is the really accurate form of testing, that many of you will have seen that in the early days we were seeing capacity for between 10 and 25,000. We're now up to 60,000 tests being able to be performed a day. That's what we will be doing in the early stages, but as cases grow, we will increase the use of rapid antigen tests, albeit it being a less accurate form of testing.
And you're confident that they'll be here when we need them?
Well, of course, we've been given confirmation of supply, and I've broken down for you the numbers that we have had confirmed versus those we have ordered and are waiting delivery schedules. We're not alone in the world that at the moment many countries have orders where they do not have confirmed delivery, but you can see that over a 5-week period we have had confirmation of 40 million on order and await those schedules.
Are we only boosting those PCR numbers because we can't get rapid antigen testing in New Zealand?
No.
So why are we only doing that now, increasing that capacity?
We've been increasing PCR testing capacity for the entire pandemic. It's been something that we have continued to grow. Right at the beginning of the outbreak, PCR capacity, of course, was in the low thousands. So we've been on a continual mission to grow that capacity across the country so that we have the ability to provide the most accurate test possible as widely as possible.
Masks research
But just we know practically that over time, when you see it grow, you do need to provide a more rapid and more widely available test. But in this early stage, when we're still stamping it out and seeking to stamp it out, PCR remains our best option.
With the masks, research overseas shows that if you have a tightly woven cloth mask, that is superior or as good as an ill-fitting surgical grade mask. Why not just make it a rule that you have to have a well-fitting mask? Why have a blanket rule?
Well, anytime we make a rule, of course, then you have to make sure that you've got the ability to then test and enforce. And designing what a well-fitted mask would mean, of course, would create the difficulty of who is it that is going to assess that whether or not yours is well-fitted or not. The best thing we can do is say, look, a bandana is not good enough, a scarf won't provide you protection, and a T-shirt definitely won't. We are asking for something that connects over your face as a face mask does, rather than just simply a scarf wrapped around your face. And the Ministry of Health is providing good, solid guidance with more detail. But guidance versus rules then have to be enforced and measured, and that opens up a whole wide range of issues. Perhaps you might want to speak a bit more on some of the guidance the Ministry is providing.
Just to add that our guidance for the public will be very much around that, ensuring that whatever mask you have, it's well-fitting, and that could be a good 3-layer reusable mask or a medical surgical mask, or a combination of both actually, to help with a good fit. We're not going to be recommending the use of N95s for the general public in going about your daily business, partly because they are expensive and they are harder to get, but some people may choose to do so, in which case we will be providing good advice about how to get a good fit to make sure it is as safe as possible if you are using an N95.
A 3-layer mask, so you can have a cloth mask if it's 3 layers, is that...
That's our recommendation. So the Prime Minister's outlined for those people that will be required to use masks in certain settings under the red, in certain places under the red setting, that will be a medical grade or surgical grade mask that meets certain standards. The advice for the public will be around the use of a reusable mask that is a 3-layer, and most of those are material, but that is important. And in some, that layer is a filter that one can insert and replace.
Again, this is guidance rather than a rule, but I think what people are looking for is guidance. That's what the Ministry of Health is providing. Where the rule kicks in is simply to say it has to be something that is actually made to be a face covering.
5,000 Māori got shots post November 1, but they're not eligible for their booster until March or later. Will you be closing the gap for them to be able to get their booster down to 3 months, perhaps?
Of course, that's any change into the vaccination schedule or the gap between vaccines is something that we do based on medical advice. So I'll just turn to Dr. Bloomfield on that.
Thanks, Prime Minister. First of all, one of the key reasons we advised, and I think the government agreed to reduce the interval from 6 months to 4 months, was because we did have a number of our high priority populations getting their primary course later in the year, November and December, and we didn't want it to be 6 months out that they were then getting their booster. Secondly, I have asked for advice from our technical advisory group about the interval, and we will keep that under advisement. I should say that New Zealand already has one of the shorter intervals at 4 months. For example, the USA is still 5 months. In many jurisdictions, it's still 5 or 6 months, but we will keep it under review.
Asking for a vaccination task force for Tamariki, given that we're trailing behind. Will you consider that as well too?
Well, actually, we've been working very closely with iwi, with the New Zealand Māori Council and our Māori providers since late last year, November, December, on the plan for rollout to Tamariki. And I'm very confident that there is a set of plans underway that are well underway that will lift our vaccination rates for all children, but with a specific focus on ensuring we do get our Tamariki Māori vaccinated.
Phil, you said earlier that...
and then I'll come to you, Jane.
Yeah.
Go ahead, Barry.
You said earlier that, in fact, you'd been trying to get rapid antigen testing orders for some time. How long?
Oh, we've had the orders in for some time. In fact, we've had...
Some time.
Oh, well, we have been ordering them for months, and that's why we have quite a number already on shore, and they have been used and are being used by some businesses. Actually, there are over 20 businesses that are using them as part of their ongoing surveillance. They have been in use in healthcare settings through our Delta outbreak for people arriving, for example, in emergency departments and some staff. And we certainly upped our orders in the last few months of the year last year. Again, the issue is not so much the orders, it's getting confirmation of delivery, and we're pulling out all the stops to make sure we can get confirmation of those many millions that we have on order.
The also thing to factor in is that they don't always have long shelf lives available with them as well.
Is the ministry going to relax the isolation rules for Omicron, given that businesses are really going to suffer as a result of this?
Do you mind if I pick that one up, Barry? Well, actually, I'm going to pick that one up, of course, because first of all, you will have already heard us talk about for those essential services where you will have seen it's really critical for them to be able to continue to operate, even when they have some of their workforce who may be identified as contacts. So there, they will be able to use a test to return to work regime. So that is something that we're likely to use across the course of the Omicron outbreak, but more detail on when we'll kick that in tomorrow. More generally, we'll be sharing tomorrow what phase 2 and phase 3 looks like for the definition of contacts and the treatment of contacts, quarantine and isolation periods.
To clarify all that testing out of isolation, like, will you be able to use a RAT for that, or would that only be PCR testing?
That would be rapid antigen testing would be part of that.
Yes.
Be available to essential workers. How are you going to resist the pressure from all the other workers or the other people who want to get out of isolation and use a RAT to do it?
I think it's just one point to add here. Of course, we do want to still limit people's contact with individuals who may potentially have Omicron. And of course, we know that when you have a large number of people who have it, the number of contacts you have will increase exponentially, and that impacts on critical workforce. So that's the reason we're honing in on that group, to allow a way to test but still be in the workforce. It does, though, come with some risk operating in that way. So that's why we have been quite targeted in who we're using that option for.
Yes, just to reiterate, the mainstay of course, reducing onward spread is isolating people. It's what served us so well to date. The intention around the use of rapid antigen testing is for those critical workforces to avoid the issues that other countries have seen around supply chains and so on. And a prerequisite will be that people are not symptomatic. If they're symptomatic, they need to isolate, regardless of whether they're critical or other workforces. If they're asymptomatic, there will be an opportunity, and we will be providing and working with employers to ensure they have access to rapid antigen tests to support that return to work.
Can you please give more detail?
Forgive me, I can't call if I can to you.
Can you please give more detail about what Omicron and the red level might mean for borders? For example, could there be a scenario where MIQ becomes redundant if there's so much in the community and they might be loosened, or the opposite?
I think the first point I'd make is borders have served us really well. It has enabled us to slow down the entry of Omicron into our community versus what the rest of the world has seen. And that's allowed us to see now the rates of boosters already available as a result. When it comes to the border changes in the future, of course, we had anticipated and still anticipate changing our border requirements to allow self-isolation for returnees. But you will have already heard, we set out that plan at the end of last year. No changes have been made to that. So that, as was set out then, is a staged approach to allowing individuals to isolate at home once they've entered into the country. We still will have a self-isolation requirement, though, because while we're dealing with Omicron and while there is still the potential of other variants in the world, we want to make sure that we reduce the number of new cases that are being seeded, because it's our view that that's what's seen a large and significant scale of outbreaks overseas.
Brought forward, for example, if the predictions of within a few weeks potentially it's spreading throughout the country, does MIQ actually still serve its purpose?
The first phases were already scheduled for late February. And what we want to make sure is that whilst we're dealing with Omicron, that we are still being cautious in our reopening plans to make sure that, yes, we are making progress, but we're doing it in a staged way that doesn't lead to an overwhelming of our health services or an exponential increase in cases in a way that jeopardises the access to healthcare that we want New Zealanders to have.
Bring it forward. Are you sticking to the plan as laid out at the moment?
Cabinet has made no decisions. Cabinet's made. You'd
consider if there was so many cases in the community that actually, as I said, the MIQ at the border doesn't serve a purpose?
As I've said, from what we've seen overseas, there's good reason to be very careful with Omicron and the rapid rate at which it moves. And our goal is to make sure that we are slowing it down so that, yes, we will see an increase in cases, but we want our health system to be supported to manage those. That means being careful about our reopening, which, as I've said, we made decisions at the end of last year around how that would work.
Follow on from that.
Yes, sorry, I'll just
No, let you follow up. I'm sorry, just to follow on
sorry,
from that
Jo.
question.
Yep.
You have indicated the end of Feb. Are you able to give certainty to people overseas? Because obviously before Christmas you'd set out those 3 very specific dates about that phased reopening. When is Cabinet going to decide, and when can people expect you to set out those dates again of a phased reopening?
Well, Cabinet has not changed any of the dates that we've already decided on. What people are... Sorry?
So what is the end of
So
Feb
you'll
date?
recall that we remembered that we moved the reopening for New Zealanders in Australia, then the staging after that was for the rest of the world, and then it was for other visa holders, and no change had been made to those dates that were set out at the end of last year.
Ask as well on boosters. Is there plans to, I know on Sunday you talked about people being away on holiday and coming back and hoping that plus the fear of Omicron would drive people to go and get boosters.
The motivation of Omicron.
Yeah, are you, fear, motivation. Are you planning any sort of specific campaigns, incentives, fax-a-thon booster style type things to get people actually moving? Because from my experience, it's quite alarming how many people don't actually realise that the booster shot is what will protect you from Omicron.
Well, you can certainly help us with that. And I don't underestimate our ability collectively, if we work together, to keep sharing how important it is. You've seen today already the impact of Omicron arriving on booster numbers. We've seen a big jump today. It's one of the biggest days we've had for some time. But as we have all the way through, we are thinking about everything that we could do to make a difference. And so actually we have thought about days of action. It has worked well for us in the past, and that is something the Ministry is considering.
Information about Bloomfield on what it is that you're planning to do and when?
What I suggest is we can do that by way of follow-up. There's quite a program of work, and in fact, I'm missing the meeting at the moment. That's the weekly meeting that goes through that. We're not necessarily planning a big national vax-a-thon, but there will be some activities. But as the Prime Minister said, yesterday 57,000 doses, booster doses in one day, and the bookings are strong at around 55,000 a day. That's just booked, and we're expecting walk-ins on top of that. So I think the message is getting out, and yes, we'd very much appreciate your support in helping us let people know the importance of boosters for protection against Omicron.
And Jo, you're right. I think everyone understood 2 doses for Delta, 3 for Omicron. We know that booster dose is making a difference, both early on in the transmission of Omicron, but just in keeping people out of hospital. So it is so important.
I'm just back to what you were saying about the booster timetable. You said that you were talking to your advisor group from lowering that from 2 to 3. Would that be
4 to 3?
Sorry, 4 to 3.
Yeah.
Would that be across the general population?
That would be if that's the advice, and I think we have to take into account a range of things. We've actually already got the interval of 4 months was one of the shortest in the world, even before we had Omicron, so we were already acting, and that's serving us well. So we would take their advice about whether there's any additional value in going down to 3. And of course, then we need to look at supply and capacity in the system as well.
Just on that move, can you provide us with a bit of a time frame as to when you ask them and when you can expect their advice on that? Because time is quite of the essence given the time frames around this.
Keep in mind, of course, that our technical advisors are able at any time to make any recommendation. They don't have to be triggered by us asking the question. But I think probably the thing that they'll be looking at as well is what is happening overseas. Japan's at 6 months, Singapore's at 5 months, the US is at 5 months, Belgium's at 4 months, Canada's between 3 and 6, and Australia's between 3 and 4. So there's wide variation, even when you take into account countries that already have Omicron.
Yes, so it will be an ongoing discussion. They meet weekly, chaired by our Chief Science Advisor. There are 2 other areas I've asked them to look at too. One is the issue of booster shots for 12 to 17-year-olds. Back to my comments on Sunday, actually Pfizer hasn't, to our best of our knowledge, applied to any country for approval for that group. In the US, they have decided by looking at the evidence to give an emergency use approval for doing boosters in that age group, and 1 or 2 other jurisdictions have. So we are looking at, I've asked them to look at that, and including the use of boosters in immunocompromised individuals who are 12 to 17. And the third area I've asked them to keep a watching brief on and perhaps get back within the next couple of weeks is that interval for the between the first and second doses for our 5 to 11-year-olds. At the moment, that is 8 weeks, and I've asked them for just to keep that under review and come back to us.
Mikey, Bernard, then Amelia.
Just wanting to change topic for a quick minute here. We have deadlines, apologies. But in Paihia recently, your car was blocked and it was forced up onto the curb. What did you make of that incident and your car being forced up onto the curb like that?
Look, I didn't, not too much. I mean, every day is faced with new and different experiences in this job, and that I saw as just another day.
In the vehicle?
Oh, look, if you wouldn't mind, I always a bit careful about how much I give away about movements and who's with me and who's not with me at any given time. But what I can tell you is at no point was I worried about my safety or the safety of anyone that was with me. We are in an environment at the moment that, does have an intensity to it that is unusual for New Zealand. But I do also believe that with time it will pass.
Target, though, of that intensity. Why do you think that is?
Oh, look, actually I do know others who are experiencing that intensity, yourselves being amongst them. And I see that as just being a reflection of the fact that we are the decision makers. And if people don't like the decisions that are being made, then it's us that, of course, will hear the feedback about that. But that's not unusual.
Prime Minister...
Yeah, Bernard. And then Amelia, and then I'll come into the front.
Prime Minister, when can general members of the public expect to be able to go to a pharmacy or a supermarket, buy some rapid antigen tests, take them home and use them at home, like they do overseas?
Yeah. So actually, I'll just narrow that down a little bit because you'll have heard from the principles of testing supply for New Zealand is that we want to make sure that they are free. We don't want the fact that you have to pay to be a barrier to people accessing the testing that they need. So free is one of our principles. Accessible, so using local providers is one of our principles. So in some cases that may be community health providers, GPs, and also we're looking at the ongoing role of pharmacies in the delivery of those tests as well. And then there's the groups who access them. So essential workers, as you've already heard me set out today, symptomatic individuals, close contacts, and of course vulnerable populations generally. That you will pick up, though, by what I'm not listing in there is we want to be careful that individuals who are just wanting to check for no reason, they're not symptomatic, they're not a contact, they have no reason to think they've got COVID, that's not necessarily a good use of testing resource. And also, because rapid antigen tests can produce false positives and false negatives, we do want to make sure that we use them in the right environments.
So you're saying that you're not expecting households ever to be able to use them themselves at home?
No, well, no. Look, it may well be that people are able to use them at home, but we want to make sure that when people are using them, it's because there's good cause to use them. They're a contact, someone in their household has COVID, they're symptomatic, where they're part of a surveillance regime because of their essential work, for instance. But just people testing in a widespread way for no reason actually is not something that I think you would want to encourage, given false positives and false negatives. We don't want someone staying at home when they don't need to.
What people overseas are doing, particularly when the Omicron outbreaks are very high.
I think you'll find that in some places that has changed a little bit. Not everywhere. I think where you previously were accessing in that way are still accessing in that way. And in some countries where you've been able to access like that, you've then seen that they've had a trouble with supply for their symptomatic population. So look, more detail on all of those elements you'll hear us talk about tomorrow, but those principles are something that's guiding our decision making. Essentially, the summary, people who need a test will be able to access a test.
Finally, on the critical workers you mentioned who will be able to go back to work with a negative RAT. What proportion of the workforce, how many do you expect to be in that special category?
Yeah, and so that's a process that MB, Ministry of Transport for Transport and Freight Links, Ministry of Primary Industries for food production and processing are going through and identifying and working alongside those essential industries. So those are all the areas and departments that are working through those lists. Whilst we'll collectively work through who we believe should be eligible, there will also be a process available for those who believe that they may have been missed.
Can I just
In terms, I'll have to check whether the final numbers, but it will be iterative, Bernard, because of course we can go through an exercise and identify based on the experience we've had at every stage, and our alert levels helped us identify critical workforce, but it will be a bit iterative. The starting number we have is likely to grow.
Amelia. Thank you.
And then
Immunologist Tony Blakely is suggesting over 60s should voluntarily hunker down over the coming month to 6 weeks to avoid the coming Omicron wave. What is your response to that?
Look, I'm not a clinical specialist, so anything that comes down to clinical advice on how the vulnerable should behave, I throw to Dr. Bloomfield on.
Thank you, Prime Minister. Just to correct, my good colleague Tony Blakely is an epidemiologist. I'm sure he would love to be an immunologist, but he's an epidemiologist. Look, I would take that as his view he's expressed from Melbourne, and my understanding is I think he's given that advice to his parents. Of course, what that does fit with is our advice, and we gave it early on in the pandemic as well, is that people who are at higher risk, which includes older people, should minimise their contact and the risk that they will come in contact with the virus. And when there's a lot circulating in the community, it may well be sensible for them to do so by remaining at home. But I wouldn't describe that as hunkering down for the next 4 to 6 weeks.
I also note that Professor Blakely also acknowledged that, in his view, the New Zealand quote plan looks really quite good, to be honest. By increasing those public health and social measures, decreasing density, it will slow it down. And of course, he comes from the experience of observing in another country different measures, and that is our intent, is to provide protection as much as we're able to all population groups by slowing it down and by providing boosters.
And just on the test to work regime, with one rule for the general population and another for those critical workers who may have to go back to work when there has been an exposure event, are you just throwing those critical workers under the bus by sending them back to a place that is potentially they could get Omicron?
No. And of course, as has been said all the way through by the likes of Dr. Verrill, a rapid antigen test is a test. It's not a preventative measure. We're still asking and providing advice to workplaces on how to best protect their workforce. You know, a rapid antigen test doesn't stop you from getting Omicron, but mask use, and we've put out more guidance and requirements today to protect workers. Social distancing, and we have requirements there to protect workers. Boosters, and of course workers can be able to take leave to get a booster paid. These are all measures to help look after our collective New Zealand workforce.
Government asking more of the critical workforce than the general population?
Well, actually, our health workforce have been giving all the way through this pandemic. And yes, we should acknowledge that. And there are other critical workers who are doing the same. But our job is to make sure that we provide them as much protection as possible, and we are doing that.
Would medical workers be
if you don't mind, I did promise a front row, so yeah, Michael.
Dr. Bloomfield, the increase in testing capacity, is that based on pool testing? And if so,
yes.
What's the ratio, and are you expecting that to be affected as the number of positive cases goes?
Yes, so pooled for 60,000, then for single it's 30,000, Doctor?
It's about 38,000. So yes, as we get to higher positivity rate, that you can't really pool test because you've got more than one sample often in that pool that is positive. So, but we still have a standing capacity of around 38,000 tests a day unpooled, which is good.
And keeping in mind that, as you will see from the phases, when we get to a positivity rate, 5%, Dr. Bloomfield, where you would stop using pooled, we would also likely to be considering then the integration of rapid antigen tests, so that would supplement and increase our testing capacity when you reach that point. Yeah. Yes.
Just on antivirals, will you be doing anything to get them into the country sooner?
So you'll know that we acted very quickly on antivirals, often putting in place purchase agreements before they'd even finished some of the processes they need to go to allow them to be used in countries. So I'll have Dr. Bloomfield talk a little bit to that.
Yes, so the two that we're particularly interested in are the two oral ones, remdesivir and Paxlovid, the latter being the Pfizer one. And Pharmac acted very quickly, was one of the first countries to get orders in, even before the manufacturing had started of them. So we have the orders in. We are, of course, dependent on when supply can be provided. And in the meantime, MedSafe has got some of the information to do the assessment and the approval process for Paxlovid. We haven't yet had an application from MSD around remdesivir, but we are in regular contact with them to get that. But what I would say is the approval process is not a barrier to their use. We are reliant, as are other countries, and at the moment I'm aware that only the USA in particular has got a supply of Paxlovid that they are, in a sense, trickling out into to be used, but that supply is just coming through quite slowly, even in the USA.
Yeah. Oh yeah, I'll let you finish. Sorry, I cut the question off, then I'll come to you.
Just very quickly on novavax, so it's been approved for adults in Australia. Once it's approved here, how do you envisage it putting in rollout as a primary vaccine and a booster?
I've applied around primary vaccination, but it's been a matter of waiting for them to provide data, as I believe.
Yes, so we've just got another tranche of data from them, and MedSafe have updated me and said probably in about 2 weeks' time they'll be able to get the formal independent assessment. And we have regular discussions with Novavax, so we have over 10 million doses as part of the advance purchase agreement. If it's approved, we then will we will get advice on the decision to use and what role it would play in the program. As the Prime Minister said, they haven't applied for it as a booster, so it would be as a primary course. I know there is interest amongst a group in the population in Novavax, and so we would be putting advice up to Cabinet about whether or not to include it as part of the program at this point.
Yes.
Prime Minister, Dr. Verrill's statement says that businesses will be able to sell rats to any authorised person or classes of persons. Could you explain what an authorised person is?
That's a level of detail that actually I would need Dr. Verrill to work through with you if I may, but you'll have a full stand-up with her tomorrow afternoon, but feel free to put that query directly to her office in the intervening period if you'd like. Yeah, so I'll go Henry and Joe and, we've got a full complement of TVNZ today, and then I'll finish with Jane then, I think, at that point.
For the testing out of isolation regime, would it cover health workers, particularly health workers at care homes?
Sorry,
For the testing out of isolation regime, would it cover health workers, including health workers at care homes?
I'll let Dr.
Yes, it could, but acknowledging that care facilities, age residential care, is a high-risk setting, and it's one of the few settings that we're looking at working with the age residential care sector around having surveillance testing for their staff, so asymptomatic surveillance testing. Ideally, those working in situations like age residential care would not go back to work while they were so they would do the full isolation period, and I think most care facilities would be adjusting staff rosters to enable that. Remember that it won't be every critical worker that needs to go back. It's really in a situation where you might get in a business, and in fact we've had a bit of an example of this that Air New Zealand talked about, Greg Foran talked about, that even just one infected crew member took out quite a number of their crew, I think around 40, and that one infection had quite an impact. So it's that situation where it really does impact on the business, so it's not something that would be routinely done.
Would it cover politicians?
What's that, sorry?
Would it cover politicians?
If
you were a close contact, would you be able to test out of being in contact?
Yeah, I actually haven't given that consideration, Henry. I think, of course, we've been very careful about where we apply the phrase essential worker, and for the most part, many of us, of course, can do our jobs from isolation, and so that would be our consideration, but it's for someone else actually to make that decision as to our classification.
Minister, just back on the borders, the government website currently says the government's plan to reopen the border will be delayed until the end of February 2022. Yep. Can you just clarify whether Cabinet has made a decision about those three phases, Australia, Kiwis coming in from the rest of the world, opening up to the world? Have dates been set yet? And if they haven't, when will Cabinet decide on those dates?
So you'll see that phase 1 was in Feb, but you'll forgive me if I have to go back and look at the phasing. We didn't do everyone at once from in Feb, but nor did we at any point with the reconnecting plan. It was always New Zealanders and Australia first, then some staggering to the rest of the world, and then other categories. If we have not, I believe, Joe, if you forgive me, I'll finish. I believe whilst we indicated the staggering, in March. I cannot quite recall if we gave a specific date within March. So if you allow me to go back, if we didn't, we'll likely confirm the specific date, I believe, in the Cabinet in the following 2 weeks.
At the time that announcement was made just before Christmas, that final week,
yeah,
there was no date set. End of Feb was set, there was no date, and there were dates for the original phasing. But
yes.
I'm sorry, I'm not trying to harp on, but
no, and as I've just said, where there weren't specific dates, we'll make sure that we put a date on it. But we did set indicative timelines and indicative staging.
And when can people expect those?
As I've said, in the next 2 cabinets.
So, airlines...
if I might, I'll stick with our current sweep around. But I think the general principle, Chair, is we've made no decision to detract or steer away from those guidelines that we already gave at the end of the year. They were very much set as a way of giving ourselves some additional time to continue to boost before Omicron had arrived. Of course, we know now we're dealing with Omicron in the community, and so no change has been made to those settings at this stage.
And
Jane.
Russia and Ukraine, how concerned is New Zealand about the escalating situation, and have there been any active discussions or contact with allies or partners about what's happening?
We are deeply concerned, as is, I would say, the rest of the international community. Yes, we have had engagement with others who share our same view on the tension between Russia and Ukraine and the need to further reinforce the sovereignty of the Ukraine. Just last night, I spoke with the President of the EU Council and shared again our concern and the fact that we would be continuing to watch closely any escalation and take any steps required to further reiterate our position on the Ukraine-Russia tensions. Same position we usually take. We're seeking the de-escalation, as is the global community.
Sanctions, as we've seen in the past?
Yes, we don't have an autonomous sanctions regime, but we do have other mechanisms that we will use if we see any activity that we believe, is a breach of the Ukraine's sovereignty.
So what are those options on the table or that have been discussed?
You'll have seen the sweep before. It comes down to things like political engagement, where there are in place aid and development programs, the ability to travel into New Zealand.
So on the wedding in Pukekohe, we've been told that up to 250 people from all around the country were there. How concerned are you about this event?
Dr. Bloomfield.
Yes, I mean, it is a concern. That's why it's been followed up as an exposure event and why we have, if it's the one I think you're talking about, why we have identified it as a location of interest, because there will be people around the country. So we don't have a sense yet of what the degree of risk is, but we're taking a pretty cautious approach there, identifying it as a location of interest, asking people to isolate and be tested immediately.
Again, we just keep asking anyone, regardless of whether you were linked to any of these events, if you're symptomatic, if you're unwell, if you have a sore throat, please go and get tested. We've got plenty of testing capacity. It's there and available for people. Yes,
just briefly on the borders, the airlines haven't booked or haven't arranged flights for March and April. Is it really realistic for people to expect there could be home isolation flights in March and April? If 6 weeks, 2 months in from now, that's the peak of the Omicron outbreak. Could we really open up when we're right at the peak of the outbreak?
Of course, keeping in mind that it is a staged and careful reopening that still requires home isolation. And so that's a really important thing to remember. Many other countries where they've had reopenings, they have allowed people to simply, after an initial test on arrival, to move into the community. That is not the decision that we have made. Ours will still require self-isolation and a testing regime attached to it. Yep. Okay, thank you very much, everyone.